And we're going to have a special guest here who's going to spend some time with us. We've had her on, may have been about a year ago, on a different issue. Dr. Farah Khan, a board-certified plastic surgeon. First of all, Dr. Khan, welcome to the program again. Hi, how are you?
Good. Thank you for having me.
The reason for having you on today, of course, the whole world is flipping upside down and sideways over this whole transgender ban that the president has come out with in the military. What I wanted to talk to you about was another angle of that, because some people have said, well, there's no reason to not do it because it doesn't cost anything really for the military to have them in there. Can you walk me through, and I realize this is a little delicate, Doctor, and I appreciate you being on. Can you walk me through the types of procedures necessary for sex changes and the ongoing treatment? Because I heard figures this morning and did some examination, not counting the surgeries, just the ongoing hormonal care and follow-up drugs and things like that, that for transgenders in the military, their health care costs run about 14% higher than the average health care costs of somebody in the military. Does that figure surprise you?
No, it doesn't. I think the main thing with transgender individuals is they do obviously need hormonal therapy for the rest of their life.
Right. Hormonal therapy
probably costs anywhere between $1,500 to $2,000 a year, which really in the big scheme of things isn't a huge amount. They typically do require some sort of psychotherapy or counseling, typically prior to treatment and prior to any sort of surgery, and then typically also during the surgery stages. So, you're right. It is, it is an amount. It is expensive. But if you compare it to kind of the overall budget, I think, of the military, it's a very small amount. I think the Rand Institute, I think they had estimated it would only be like 0.05 to 0.13%.
Now, is that because the cost is not that great to the military? It's not really because of the cost per, but it's because of the number of people that are in the military that are transgendered is a very low percentage, correct?
Yeah, and that's why.
Yeah, which is kind of important to know. Do you personally, in your practice, have you been involved a lot with dealing with cosmetic things for people involved in transgender surgeries? Because, everybody thinks of transgender surgery, adding breasts, removing breasts, changing genitalia, that kind of thing, and certainly that's involved. But a lot of times there are facial changes that need to change, at least on the part of the person having the surgery done, because they feel, well, now I don't look feminine enough, or I don't look male enough. So there are other things other than just the organ change going on, correct? And have you had much experience with that?
I don't do those surgeries. But, as a plastic surgeon, we're trained, obviously, to do all that.
Right.
And so gender reassignment surgery simply refers to the genitalia changing surgery. And so that's the type of surgery that may be covered under insurance. But even then, it's a pretty extensive process. Typically, the patients have to demonstrate that they've taken hormonal therapy for about 2 years and that they've actually lived as whatever gender they're now identifying with in the community for at least 2 years. And you still need medical kind of recommendations from a couple of doctors saying that you are fit to undergo surgery. Mm-hmm. So the first stage is kind of that gender reassignment. All of the cosmetic stuff, like you're talking about the facial feminization, a breast augmentation, liposuction, whatever, that would be afterwards, and that would typically, it would always come out of the patient's own pocket.
Because that would be basically elective surgery? Is that why we're saying that?
Exactly. And that's more cosmetic. It's just like people who are overweight. And typically insurance will cover the weight loss procedures, but they're not going to cover the tummy tuck and the breast augmentation or the lift or the thigh lift that a lot of those people who lose 100, 200 pounds need or want, because
Right.
It's considered more cosmetic.
Right. When I may be asking you something that you're not comfortable with answering, but I'm just going to ask you. I know that before you go into gender reassignment surgery, that there is a requirement, and I can't remember if it's a year or 2 years, but there is a pre-surgery ramification you go through where you're receiving counseling and everything before that kind of surgery. Is it, in your view, and again, if you can't answer this, feel free to just tell me to jump off a cliff. But in your view, is that level of counseling required not just because of the trauma of surgery itself, but because there is some concern that the person might be asking for something they're not even really sure what they're asking for?
Well, I think the real reason why it's required is to make sure that the patient understands that what they're about to undergo really is irreversible. And so you want to make sure that the patient has really thought about what they're asking for, that, as I said, they've demonstrated they can live as whatever gender they're identifying with in the community, and that this is really what they want. And so I think once you demonstrate that, mentally, emotionally, socially, they are able to be that gender, then, the surgery makes sense. Because, again, it's irreversible, and so you cannot go back.
Yeah. One last question, and again, we're talking to Dr. Farah Khan, and she is an expert at cosmetic surgery, and we're very glad that she's come on to discuss this, because this is beyond I like gays, I hate gays, I like transgenders, I don't like transgenders, they should serve, they shouldn't serve. Regardless, doctor, of where somebody falls on those arguments, when you get somebody in there, these are huge decisions. I mean, they're enormous decisions. And secondly, the follow-up is not easy. Now, this is a horrible transition here, and Farah, I'll admit it to you now. Last year in May, I had a kidney transplant, which is a large surgery. But the follow-up to it, I mean, there are things I must continue to do, or everything that we've achieved through my surgery could, to some extent or to the fullest extent, come undone. The ongoing hormonal treatments that the people have to take once they've gone through gender reassignment surgery, those are forever, and you can't stop taking them. I mean, you have to stay on that regimen, correct?
You do, but, I think just talking to your point, kidney transplants or any sort of organ transplants, I think immunosuppression is a big deal.
Yep.
You're right. If the body rejects it, it can be devastating.
Correct.
In this case, it isn't necessarily devastating. I think the majority of patients will choose to stay on hormonal therapy because that's what's going to help them maintain certain characteristics. But there are actually, there are some people who choose not to afterwards. And it isn't necessarily as devastating as, let's say, someone who chooses not to keep up with the immunosuppressant.
Okay, yeah, because I can tell you the immunosuppressant end of it is very large. In fact, at the end of December, I contracted a virus, which is a rather common virus, CMV, but because my immune system was suppressed to such a low state, I was like a sitting duck. So, there's certain things you just have to be careful of, and you certainly don't want to reject the organ. So you watch that. So what you're telling me is in these follow-up drugs, most would like to do it because it helps them to continue the look and maybe the feel of who it is they think they've become. But to stop the treatment, the hormonal treatments, is not necessarily life-threatening.
Exactly.
Okay. All right. Very good. Yeah, and you're right. When you say, and I hate to put a number on it, but when you say that the actual surgeries, the reassignment surgeries are not cheap, I saw numbers today, and there may be 2 or 3 surgeries involved sometimes, but that some of them could be as much as $50,000. Does that sound right to you?
Mm-hmm. Yes. I would say the initial gender reassignment surgeries probably cost anywhere from $25,000 to $50,000.
Wow.
Just depending on the extent. But then you have to realize afterwards, the cosmetic aspect of it kind of kicks in. So if someone would like liposuction for waist contouring or body contouring or facial feminization surgery or breast implants or a chin implant or a nose job, you're adding all of those on, and that could easily be another $50,000, $60,000, $70,000 that majority of patients will be paying for out of pocket.
Right. Yeah, and that's part of the fight, because some are saying, well, if they're in the military should pick that up. And I think that's going to become a real angle that's going to be a problem for some people. Well, Dr. Farah Khan, we very much appreciate you being on. You were very insightful the last time we had you, and you've helped us here again this time, and I appreciate it very much. Thanks for being here today.
Well, thank you for having me.
You bet. Thanks so much.